Hello, I'm Dr. Alexandre Amato, vascular surgeon at the Amato Institute, and today I bring you another video on a topic that fascinates me, which is lipedema. I'll be talking about bariatric surgery and lipedema for several reasons. Because it's very common for me to see patients with lipedema who have had bariatric surgery in the past, or who are planning bariatric surgery, or who are afraid of having bariatric surgery. What is the relationship between obesity and lipedema? And that's what we need to discuss to understand bariatric surgery, because bariatric surgery is one of the treatments for obesity, not for lipedema. Lipedema is resistant to low-calorie diets, and what bariatric surgery does is exactly that. It reduces the amount you eat, forcing a low-calorie diet. So, bariatric surgery by itself is not capable of changing the disproportion of lipedema. Obviously, eating much less can reduce the volume a bit, but the body disproportion will remain, and the inflammation can also persist. So, bariatric surgery will not solve the problem of lipedema. It happens that many patients with lipedema also have associated obesity. And this obesity can indeed be treated with bariatric surgery. Obviously, following all protocols, having undergone conservative treatment first, it's not as simple as wanting bariatric surgery and just going for it. So there's a whole process to reach that point. So obesity, it causes inflammation, and this inflammation from obesity can also worsen lipedema. Now, so when we have both conditions together, we need to treat both. We can't just focus only now on obesity because it won't solve lipedema, nor can we treat just lipedema because it won't solve obesity. So bariatric surgery aims to treat obesity, and consequently, by eliminating the problem of obesity, you give a chance for lipedema to improve as well. So you reduce one of the inflammatory causes of lipedema. Many women get worried, those who have already had bariatric surgery in the past. Oh my, was it necessary to do it? I just found out I have lipedema. I think I didn't need to have bariatric surgery. First of all, I would say, don't dwell too much on the past. Don't suffer too much over it. Let's look ahead, because it's very common for lipedema to be accompanied by obesity and the criteria for bariatric surgery. And the BMI are extremely high. Usually people with lipedema also have associated obesity. It's rare to have such a high BMI and it be pure lipedema. So most of the time I see bariatric surgery being done following all the indicative criteria. It really needed to be done. What I also see is that those who thought they only had obesity and didn't treat the lipedema didn't see much improvement in fat loss in the thighs and legs. It decreases a bit, but it doesn't completely resolve it. So it doesn't solve all the inflammatory symptoms of lipedema. So now that they seek this treatment, they come with this concern. What I see nowadays is that there has been an exponential improvement in the quantity and in the quality of conservative treatments for obesity. So if a treatment for obesity is done very rigorously, it's quite possible to avoid bariatric surgery. There are some groups commenting that the latest advancements in medication might eliminate the need for bariatric surgery. I also think it won't come to that. It will always exist as one of the tools in treatment, especially for that refractory obesity, where it can't be resolved in any other way. Now, many times refractory obesity also comes with lipedema, because if you treat obesity but not lipedema, there won't be any improvement. So it's very important to get an early diagnosis of lipedema to achieve good results in obesity treatment as well. Talk to your vascular surgeon who specializes in treating lipedema, and clear up all your doubts. Did you like our video? Subscribe to our channel, share it with your friend. See you next time.